Hi, good morning all. Today I'm going to discuss about one of the OSCE stations. It is a skill station which is the administration of inhaled medication. So through this video, I will explain how to perform this skill and what all the important things you have to be observed while performing this station. So let's look in detail. Okay. First, we have to assess the area for safety. Then, we have to perform the hand hygiene. Then introduces ourselves and explain the procedure and get the verbal consent from them. Okay, we should explain everything in detail and gain the consent prior starting any procedure. It's mandatory. Then we should ask the patient whether they need any assistance to sit in upright. We should ask them, request them to sit in an upright position. That is the position which we are using for this medication, inhaled medication administration. Then before administering any prescribed drug, look at the person's prescription chart and check all of the following information is correct. First, we have to check the identity of the person. First, we should ask them, could you please tell your complete name and date of birth? Then we should cross check it with their wristband. If there is any allergy, we should check that one also, and we should ask them especially what is the reaction they are experiencing whenever they take this medication or whatever it is. So it's very important. Then next we have to check the name of the drug, the dose, then date and time of administration. Is it due now? Then route and method of administration, and is there any diluent is prescribed? Then allergy I already mentioned. Then correctly check all of the following: the validity of the prescription, signature of the prescriber, the prescription is legible and the complete name of the prescriber is there, the GMC number is there. We should check everything. Any indication is written there. And if any these pieces of information is missing, unclear or illegible, the nurse should not proceed with administration and should consult the prescriber. These are the things we have to, and we should verbalize these all information are complete and it's a valid prescription, so I'm happy to proceed with the procedure. Then we should explain the procedure to the patient. Just ask them, are they in comfortable position to do the procedure? Always make sure that they are ready to do the procedure. Okay, so let's start how to. We already checked the prescription, it's complete, so we will start with the procedure. Then how to start? The patient is already sitting in the upright position, so we should take example Vendolin inhaler. So we cross check with the prescription chart, and the expiry date also of the medication has checked, and the prescribed dose and the available dose we checked. Everything is clear. So then we will remove the mouthpiece cover from the inhaler. It's very important. If you forget before shaking, if you didn't remove, you will fail the exam. Because I have some examples, one of my friends who failed only for this minute mistake. What is the next procedure? Then shakes the inhaler well for 2 to 5 seconds. Then we will use a spacer device for the effective administration of this medication. So we should explain this indication why we are using this spacer device to the patient for the effectiveness of the medication. So insert the meter dose inhaler, that is the Vendolin puff, into the end of the spacer device and ask the person to exhale completely, and then grabs the spacer mouthpiece with the teeth and lips while holding inhaler, ensuring that lips form a seal. So we should instruct them. You should exhale completely, then hold grab the spacer at the mouthpiece and then cover with the mouthpiece with the teeth and lips and make it a tight seal. Okay. Then ask the person to tip head back slightly and to inhale slowly and deeply through the mouth while depressing the canister fully. Then instruct the person to, there are two methods we can do. If the person is able to hold their breath more than 5 seconds, at that time we can use single breath technique. If they are unable to hold more than 5 seconds, we will use tidal breathing or multi-breath technique. So we should ask them, are you able to hold the breath for more than 5 seconds? So if they are telling they can, we will explain about the single breath technique. So we will ask them to breathe in slowly for 2 to 3 seconds and hold their breath for approximately 10 seconds. Then remove the empty air from the mouth before exhaling slowly through the purse lip. If they are unable to hold the breath for more than 5 seconds, how we will explain? Instruct the person to use tidal breath technique, that is breathing in and out steadily 5 times. They have to make a tight seal, everything the same. Then after that, breathing in and out steadily 5 times. That is the difference. Then ensures that the drug is administered as prescribed. Always make sure what maybe they have ordered 200 microgram like that. Yeah, so that should be make sure. Maybe the available dose is 100, so that's why we are giving 2 puff like that. Then instruct the person to wait 30 to 60 seconds between inhalations if same medication, or 2 to 3 minutes between inhalation if different medication. Shake the inhaler between the doses. So this is another important thing. Don't forget to shake the inhaler between the doses. Then next step, cleans any equipment used and discards all disposable equipment in appropriate containers. Clean hands with alcohol hand rub or washes with soap and water and dries with paper towels following WHO guidelines. Even verbalization they will accept. Then date and sign drug administration record. Then reassure the person appropriately, closes the interaction professionally. Then don't forget to inform about the side effects of enroll, and maybe this is the first time they are going to experience this medication, so tell them they may experience some palpitation like that. So try not to worry. But if they experience any other discomfort like that, they can inform or seek medical advice. So you have to inform about the side effects. I hope these videos are beneficial for those who are planning to come to the UK soon. So just try to watch it and practice so you can also crack the OSCE in your first attempt. So thank you for supporting my channel and keep watching. Thank you.